Agribusiness brought to you by Kansas Soybean Commission. The Soybean Checkoff. Progress powered by Kansas farmers.
Welcome back to the show. We're in Wichita, Kansas. We're joined by Dr. Snyder. Dr. Snyder, it's good to see you.
How do you
do?
We
both made a drive this morning.
Yes, we did.
Yes,
from Topeka.
Yes, from Topeka. Dr. Snyder has a veterinarian practice in Topeka, the University Small Animal
University Bird and Small Animal.
Okay,
we do a little bit of everything. Yeah.
But you're really doing stem cell work.
Yep, that's our primary passion right now.
Right. We talked to Preston a little bit. Some of the things that you're doing really on the companion animal side is really working wonders for pet owners.
Yes.
And pets alike.
Yes. We've had probably right now we've done close to 70 of these. We're finding a success rate of better than 95%. In fact, I'd say 100% of the 100% of the animals are showing improvement. Of course, some more than others,
sure.
Some marginal, but as a whole, most of them are showing a very nice improvement. So, been very pleased with what we're seeing.
Well, yeah, and we got to spend probably 10 or 15 minutes before we came out and did the interview, and some of the things that we talked about is not only good for the animals, not only good for the pet owners, but the economics of it is a great viability for people to extend pet lives.
I don't know so much about extending pet life. It's kind of the difference between quality of life and quantity of life. Right. We're out to improve that quality of life, to make these animals more comfortable. Arthritis is a big, big problem in companion animals and in humans, horses. If we can take and alleviate a lot of that pain, that discomfort, very good for both the pet and for that owner, seeing that they can do the best for the quality of that pet's life.
And we really talked about companion animals versus production animals too, and we had a nice little conversation about bulls or bucking bulls even in rodeos. Economically, this makes sense for someone who needs production animals to continue in whatever facet they've got.
Right now, the production animals, the bulls, the food animals aspect of this is pretty well unexplored. We're going to start getting more into this, especially with the more valuable breeding bulls like we were talking about with some of these rodeo bronking bulls that are $100,000 plus bulls that get injured. Becomes a very viable treatment modality for them. I'm excited. I've been in practice 37 years. I probably won't be around when most of this really is able to be used fully.
Right, sure.
But right now, to me, this is tomorrow's medicine. This is what human medicine will be in the short time. This is what veterinary medicine certainly should be looking for on a lot of these chronic debilitating diseases, autoimmune, arthritis, neuromuscular, all of these. We're looking for most of it hasn't even been explored yet.
Any limitations to stem cell therapies?
The only limitation that we have right now, and this may change, has been with tumors, with cancer. Because stem cells cause new blood vessels to grow, we typically try to stay away from any dog with cancer because you don't want to stimulate more blood vessel growth to a tumor. There's a lot of talk that in the near future we are going to see some cancer applications for stem cells, maybe not using stem cells to treat, but using stem cells to maybe carry the treatment to the tumor. So it's going to be used in a lot of new ways. So we're just barely on the tip of that iceberg as far as the potential for this. So we're quite excited about it.
Well, we're going to take a quick break. When we come back, we're going to talk about maybe where you see this going 5, 10, maybe 20 years down the road.
Love it.
You're watching Ag AM in Kansas. We'll see you in just a minute.
Agribusiness brought to you by Tarwater Farm and Home. Come on by. We'll treat you like family.
Thanks for staying with us. Thank you for staying with us, Doc. The future of stem cell therapy. 5, 10 years, maybe even 30 years down the line.
I think this is
dramatically changing.
Oh, it's going to dramatically change medicine. And my perspective is right now, stem cells, we're just on the cutting edge. We're just doing arthritis, the potential to treat autoimmune disease, lupus, rheumatoid arthritis, all of the autoimmune diseases are certainly going to be out there. Arthritis is going to be a given. nerve brain issues certainly are going to be, in fact, right now there's some clinical trials going on with Parkinson's disease in humans. They're using it for heart attacks. A lot of people have seen the work being done with human heart attack victims and how it can regenerate the heart muscle. Stroke victims, trauma, brain trauma. There's a lot of work being done with the brain trauma, especially with veterans coming in using stem cells. Gunshot wounds to the brain,
So traumatic brain injuries.
Traumatic brain
Right.
injuries using stem cells. We're looking at that being a major part. Pharmaceutical companies, of course, are actively taking
Right.
and investigating this, researching it. They're looking for a way to make more money on it, and that's understandable. We're just really happy to be able to
Right.
use this technology right now on animals today. So we'll be doing it with this horse. We're doing it with dogs and cats. We just did a dog from Wichita yesterday. And we also did a fracture on a dog's leg yesterday using stem cells to try to accelerate that healing. We're really excited about what that's going to do.
It's kind of a reversal of roles. I mean, we actually worked some of this stuff on humans, kind of got the ball rolling. Now we're perfecting it truly in animals, so we were kind of the guinea pigs this time.
Humans are the guinea pigs.
Yeah,
So
yeah.
this is the dumb animals get the stem cells,
right,
and I guess we
right.
can call ourselves really dumb animals
Right.
because we can't.
Right.
But it's being done. Most of it's being done outside the United States, but there are some clinics in the U.S. right now that are doing stem cell therapy actively, and the results have been nothing short of spectacular.
Do you see as it becomes more common practice that the price continues to come down? And because we were talking earlier, it's, you know, someone who's got a companion animal, do they want to spend the $2,000
Sure.
to extend quality of life for that animal or something like that? As it becomes more prevalent in veterinary medicine,
Yes.
price tends to come down just like everything else,
Yes.
I would assume.
As the price comes, as the technology becomes more prevalent, just like with anything, the cost is going to drop. Right now, a lot of it is there's essentially 2 or 3 companies doing this. I've investigated all of them. I feel that Medivet has the technology that is right now state of the art. If someone else comes along with something better, new technology, I'll be looking at that. But right now, as far as the industry, Medivet, this fat extraction technique that we're using is state of the art.
Well, we want to remind everybody you're located in Topeka, right next to Team Sports or across the street from Team Sports, there on 17th Street. Website, people can go and get some information on you, or a phone number to call?
Website is universitybird.com. Phone number is 785-233-3185, or if they'd like some more information on the technology, it's Medivet America, meta-vet-america, or metavetamerica.com.
Perfect. Doc, thank you for your time. It's very nice
We'll
to
talk
meet
to you later.